Friends, today we discuss the hip bone osteology. This is the hip bone. So hip bone, it is present in the gluteal region, skeleton. It is also called the innominate bone. It is not a single bone. It is a union of the three bones at the acetabulum. This is the acetabulum. Here three bones are united together. Above the acetabulum, this fan shaped which is there, that is called the ilium. This is the above the acetabulum is the ilium. Antro inferiorly, this is the pubic bone. This is the pubic bone. Postero inferior to the acetabulum. Postero inferior to the acetabulum is the ischium. So this is the ischium. Ischium. This is the pubis. Above the acetabulum, this is the ilium. So hip bone is not a single bone. It is a union of the three bones at the acetabulum. Upper bone is the ilium. Postero inferiorly ischium. Antero inferiorly pubic bone. Now one by one we will discuss. First hip iliac bone. Iliac bone is a fan shaped bone. It having the upper end, lower end is rounded. This lower end going to formation of the acetabulum by 2/5. 2/3 of the acetabulum. So lower end, upper end is there. It is having the, this is the anterior border. Anterior border. This is the superior border or iliac crest. This is the posterior border. Posterior border. Next, this is the sacroiliac. This is the middle border or intermediate border. Now here surfaces. This is a gluteal surface. Gluteal surface, convexity. This is the concavity, pelvic surface or iliac surface. This is the sacroiliac surface. Sacroiliac surface. So now, what are the attachments to ilium? In this first we will discuss iliac crest. It is look like a S shape. Anterior 2/3, posterior 1/3. Iliac crest is anterior 2/3, convexity lateral side, and posterior 1/3, concavity lateral side. It is irregular, this iliac crest. It is having started from the anterior superior iliac spine, it going backwards up to the posterior superior iliac spine. So main important viva question expected from the anterior superior iliac spine. This is the anterior superior iliac spine. This is the anterior superior iliac spine. So what are the attachment of the anterior superior iliac spine? Mainly sartorius muscle origin. Another one, lateral end of the inguinal ligament attachment. Only two attachments for lateral end of the inguinal ligament and sartorius muscle origin. Next, whereas the here posterior superior iliac spine, here attachment is sacrotuberous ligament. Sacrotuberous ligament. This is going to articulates with the sacrum. Now here this is the highest point of the iliac crest. It is relation with the disc between the L3 and L4. And this iliac crest is irregular. this is having the three parts like a, this is the outer lip. See here, outer lip of the iliac crest. See, this is the outer lip of the iliac crest. Next, this is the inner lip of the iliac crest. This is inner lip of the iliac crest. This is outer lip of the iliac crest. See now how it is there. Between these two lips, irregular or intermediate area is there. Okay. Now, what are the attachments of this iliac crest? Outer lip which is there attached by the anterior abdominal wall external oblique muscle. See, starting from here, tensor fasciae lata muscle. Here, external oblique muscle insertion, quadratum lumborum, erector spinae muscle. Erector spinae muscle. Next, whereas intermediate here, internal oblique muscle, whereas inner lip, transverse abdominis muscle is there. This is the iliac crest. Main important points here. Highest point of the iliac crest is relation with which intervertebral disc, L3 and L4. We are using this for the lumbar puncture, or we are introduced the anesthetic drugs into this. And also here we are collecting the aspiration, bone marrow aspiration. Next, another important point, what are the attachment of this anterior superior iliac spine? That is the sartorius as well as lateral end of the inguinal ligament. This is 200% viva question, anterior superior iliac spine. Next, anterior border is extends from anterior superior iliac spine, comes downwards, concavity, then goes to reach another elevation. This is called the anterior inferior iliac spine, then reach to above the acetabulum. This is the anterior border. Whereas the posterior border, see, it started from the posterior superior iliac spine. Next, posterior inferior iliac spine. This is greater sciatic notch. From here, you know, while doing the gluteal region dissection, we are finding the great important now sciatic nerve, posterior cutaneous nerve of the thigh, superior and inferior gluteal vessels and nerves are coming from here. Not only these, and also pin structures also crossing from greater sciatic notch to cross to outer posterior surface of the iliac spine, ischial spine. Then these three structures like a pin structure. P means pudendal nerve, I means internal pudendal vessels, N means nerve to obturator internus. These three structures are crossing here. Then it is enter into the lesser sciatic notch. So from the lesser sciatic notch, ischial spine, greater sciatic notch, posterior inferior iliac spine, up to the posterior superior iliac. This is a irregular posterior border. Next, another one here, intermediate border. Next, another viva question. What are the attachment of this gluteal surface of the ilium? So mainly here, three gluteal lines are there. One is the line, just here see, this is the posterior gluteal line. This line extends from the iliac crest, highest point of the iliac crest to up to this greater sciatic notch. Next, center of this greater sciatic notch to this line going to reach to this iliac crest. This is the anterior gluteal line. This is the posterior gluteal line. Just below this greater sciatic notch up to this anterior inferior iliac spine. So these are the three inferior gluteal line. So inferior gluteal line, anterior gluteal line, posterior gluteal line. These are the three lines are present in the gluteal region of the iliac bone. What are the attachments from these lines takes origin of the muscles? Mainly, gluteus maximus muscle takes origin from the posterior gluteal line, sacrotuberous ligament, posterior superior iliac spine. But whereas the between the posterior gluteal line, anterior gluteal line, this surface gives origin for the gluteus medius. Between the anterior gluteal line and this inferior gluteal line, here gluteus minimus muscle takes origin. So, posterior gluteus maximus muscle, gluteus medius muscle, gluteus minimus muscle. Below this inferior gluteal line, above the acetabulum, here we are identify the straight head of the rectus femoris muscle takes origin. Straight head of the rectus femoris muscle. So, these are the muscles takes origin from the gluteal surface of the ilium. So, very important viva questions. What are the muscles takes origin from the gluteal surface? Next, inner surface, iliac surface. Here, concavity which is there, this whole surface gives origin of the iliacus muscle. It is the fan shaped muscle origin. It crossing to the below the inguinal ligament, unite with the psoas major muscle tendon, and insertion at the lesser trochanter of the femur. This is the iliac fossa. Iliacus muscle takes origin. This is a sacral surface, is going to articulate with the sacrum. So, to make a sacroiliac joint. These are the surfaces, borders of the ilium. Thank you.